So today we're going to explain the centered focused ultrasound. With this treatment we can treat both the face, the neck, décolleté, for skin tightening and for non-invasive lift. We can treat the armpits for hyperhidrosis. We could also do that on the hands and the feet if our patients are sweating too much. And then we can use it on the body either for targeting fat or for loose skin. The loose skin that we usually find around the abdominal area, around the arms, and inside our thighs. So the first thing I'm going to demonstrate is about the face. So which are the areas of concern most of the times our patients come? So usually they want to lift this area. Like if you see all the patients that come to my clinic, the first thing they do is, I want this kind of effect. So they just pull a little bit at the back and they want to have this lift, or they want to have more of a V-shaped face. So how can we achieve that? We can achieve that with a centered focus ultrasound. Our target is going to be first to go and target the SMAS, which is the superficial musculoaponeurotic system that is found surrounding our muscles. What we do, we go there and we coagulate. The good thing about this kind of fascia is that it has similar properties to our skin, to the dermis actually. So similar collagen and elastin. So when we actually target it with the HIFU, we have the fibroblasts producing collagen and elastin, so it has this lifting effect. Then as a second step, we go and we target the dermis, because we want to also achieve new collagen contraction. So with age we have more of this type of movement of the collagen fibers. We want to contract them. How do we do that? By actually causing coagulation points inside the dermis. The fibroblasts, once again, they get this message that they want to produce new collagen and new elastin. This improves the general quality of our skin, improves the skin laxity. You can see that it also has an effect on the pores, because the more compact the skin is, the better, the more closed our pores are. And then we can target fine lines and wrinkles, and we can also work around our eyes. So the first thing I'm going to talk about is the mid face. So I'll take the mid face and the lower mid face, so the whole area here. Usually what you can do is with time you're going to get that by the eye, so you will know more or less which depth you should use. But for starters, what you can do is you can pinch the skin, fold it, you measure it with a pincer, and then you're gonna see what kind of, how many centimeters you have. That one you're going to divide it by 2. If you do that, you know more or less at what kind of depth your SMAS is found, because the SMAS is gonna be the lower part. So we have the epidermis, the dermis, the subcutaneous fat, and then you have the SMAS, this fascia, which surrounds the muscles. When we pinch our skin, you don't actually pinch the muscle. So if you divide it by 2, you know where it's usually found. Usually it's around 4.5 or 3. So we already know that this area of the face is around 4.5 and 3 that we have to use in order for us to target the SMAS and to target the skin. Then when it comes to around the eyes, we know that the skin around the eyes is the thinnest skin inside our body, so don't go very deep with that one. Usually a 1.5 is the ideal to work around. When it comes to around the eyes, please be very, very careful. So you are only allowed to target the area of the skin that is touching the bone. So how do we do that? We usually pull down so that we have access to the skin, and then while you're holding the handpiece, remember that the ultrasound doesn't come out from the whole area, but only from the center. So when you're gonna place it onto your patient, pull down using a tissue. Make sure you don't have any excess of gel, because that is going to sleep. So you push it down, you put it onto the area of the eye, and you start working. Same thing when it comes to the upper area. So you pull the eyebrow as much as you can, and you work on the skin that is found on the bone. If you target the skin that is not on the bone, you can actually cause permanent damage to the eyes, to the cornea, so please be very, very careful. Only on the area where there is bone underneath. Then when it comes to the forehead and around the temples, of course we have this area that we have a high concentration of nerves, so we try to avoid that one. And in general, the depth that we're looking at is either 1.5 or 3 millimeters. When it comes to the neck, things change a little bit. So the neck is something that it really depends on the individual. So you're gonna see some people that have a lot of double chin, so they have a lot of excess fat in that area. In those cases, obviously you can work with the 4.5, you can work with even with the 6 millimeters. It depends on how much you have. If you want to target more of the fat, you have to remember from our training notes that if we increase the pulse duration, instead of forming egg-like lesions that are on the same level, we form more of a cigar-shaped lesions. So if you want to target more of the fat, in those cases, increase your pulse duration. So you can go to 100, 150 milliseconds. In that case, you will know that instead of working on the skin, that you have to work in the egg-shaped lesions at the level, you form cigar-shaped lesions because you want to target the fat. So this is how your treatment is actually changing. So in this area, to target the fat, you can even work with the 4.5, just increasing the pulse duration to target the whole thing. When you have fat, it's very stubborn, so you want to increase the pulse duration, you want to target it, you have to be a little bit more aggressive. Always make sure that you have a visual with your patient. You don't want to be causing any extra lesions or a lot of redness. You can see also with their pain threshold, so start low, ask your patient how do they feel, if they feel the heat or the pins and needles, and slowly, gradually increase the energy. Now, if we don't have fat and we only have loose skin in the area, you have to work with the 3, 4.5, apart from very rare cases where you have this paper thin like skin, where you're gonna work with the 1.5. Always do the pinch test so that you know more or less in which depth you should work. When it comes to the neck, always remember that we do have the thyroid. We don't want to work over the thyroid. Doctors can actually push on one side, palpate, find the thyroid, and mark it out with a pencil. Then they can do the same thing on the other side. But more or less, we know that the thyroid is found in this area, the lower part of the neck. So you can actually point it out and just avoid going through that area. When we're working with the neck, always remember that it's very important on how you position the patient. So we ask them to turn on the side and we work this area. Then we ask them to lift up their chin and we work on this area, and then they turn on the other side like this and work on this area, because we always have to work on a flat surface. Also remember that we always have to have a good amount of gel, because we're working with an ultrasound. Without our gel to conduct the ultrasound and bring it into the depth, we will not be able to have a very good result. Last thing I want to remind you, when we're treating the neck, remember that the main target is the SMAS, the fascia that is actually surrounding the muscle. So keep in mind that when you're treating the neck, do not stop at the jawline. You need to stop here, like you take the line of the lip, because the platysma muscle, if we do this kind of movement, you're gonna see that the platysma muscle starts from here going all the way down to the clavicles. So if we're treating the neck and we want to have a very good result, do not stop at the jawline. Come all the way up to here, and you start from here going all the way down to the clavicles. So let's go ahead to see how we can actually set up on the machine. When we are treating the face or the neck, we click on the face. We make sure that here we have the right insertion of our focal point. So if you want to be using 4.5, you turn it here. If you want to be using the 3, you should be coming here. 1.5 here. So it's indicated, and you actually bring it all the way to the depth that you want to use. So Let's say that today we're gonna start with the 4.5. We set up our depth. We press next. Here, however, on the machine, if you see, it says 6 millimeters. So you actually have to go all the way until you manage to reach the 4.5. So I am at 4.5 millimeters. My handpiece is placed at 4.5 millimeters. So depth-wise, I'm ready to go. The next thing that we have to consider is the pulse duration. When it comes to the face, or when it comes to, in general, skin tightening, please choose 50, maximum 75 milliseconds. Do not choose more than that, because the pulse duration is how long the ultrasound stays inside the skin. So it's how long it's going to cause the coagulation. If it's between 50 to 75 milliseconds, like we saw on our presentation, it forms egg-like lesions at the depth we are. If I increase this to 100 and above, instead of forming these egg-shaped lesions, I form cigar-shaped lesions. So they're actually targeting the different layers. So I may be risking to burn some fat in the area. We do not want to burn any fat when it comes to the face. You should only increase the pulse duration when you're treating a double chin and there you have loads of fat. Then you can actually increase the pulse duration to 100, because you know that you're going to be forming more of these cigar-shaped lesions, so you're going to be targeting the fat in the area. But in general, I like to start with 50 milliseconds. So the next thing that we're going to see is the frequency. So it's how fast we can actually move with our machine. So if I have 1 hertz, it's 1 cycle per second. If I go to 2, it's 2 cycles per second. So the more I increase it, the faster I can actually move. I do not advise that you start with 10 hertz. In order for you to use 10 hertz, you need to have a lot of experience in your hands, because otherwise you are going to be causing the one coagulation point over the other. You will not be leaving any healthy tissue around, so the skin will not be able to heal, and then you may result in scars. So initially, just to start with the treatment, start with 4 hertz, 4 cycles per second, so that's a good speed. You move slowly so that you get hold of the machine before you actually move on to be using the faster treatment. When it comes to the eyes, around the contouring of the eyes, I do not even advise the 4 hertz. I would prefer you to use 1 or 2 hertz, because that is a very delicate area. If you do a mistake, it can actually be a permanent mistake. So when it comes to around the eyes, you move slowly, you don't use a lot of speed. So the next thing that we're going to see, just one point here, that if you're treating the body, you can actually obviously move to 10 hertz, because there you want to move as fast as you can, and there you have a big area, so you can actually move. But when it comes to the face, don't overdo it. Start with the 4. Once you feel that you're more comfortable, move to the 5, then to the 6, and you shouldn't feel comfortable from the first treatment. So you need to have a few treatments in your hands before you can actually move on to the fast treatments. Last thing, it's the energy that we have, so it's the heat that we are going to give into the area. Even if you did a previous treatment and you have used 1.2 joules, next treatment you shouldn't use this kind of energy. Always start with a little bit lower, because maybe the lady has been on menopause, or she had her menstruation, she feels a little bit sick, she has some hormonal problems, she didn't sleep well at night, and the skin is more sensitive. So if last time I used 1 joule, next time I'll start from 0.8 and then move on to 1 joule. Do not use the same energy, because as I said, skin changes from different times. Another thing is, do not start from 1 joule. So if I have a patient, I'm going to start from usually 0.6 joule. I will start and ask them, how do you feel? So you need to have a constant feedback from your patient. So I start at 0.6. I move it on to my patient. I ask them, how do you feel? They feel comfortable, they don't feel anything. Then I can go ahead and increase. Do not arrive at 2 joules. 2 joules is too much. You shouldn't be arriving at 2 joules in almost any of the treatments apart from the treatments on the body. I have quite a lot of experience on using HIFU. I arrived to 1.8 only 2 or 3 times for my treatments. So please be careful, because the problem is that sometimes people think that they want to get a better result, so they have to feel pain. No, this type of machine, you don't feel pain. You should feel it, you should feel the heat, you should feel pins and needles, but no pain. If the patient reports pain, then stop and reduce your energy. If I am at 1.2 joule and the patient tells me that still she doesn't feel anything or he doesn't feel anything, then you can go on to increase your pulse duration to 75 milliseconds. And then you can try them again. You decrease your energy and you try with 75 milliseconds, 1 joule. And then you continue to increase. Move slowly. The problem with the HIFU is that everything happens deep inside the skin, so you don't have a visual of what's actually happening. So a lot of people don't know when to stop or when they have done the treatment. Trust me, the treatment works, so don't expect to have lots of redness or for you to see something visual for you to stop. You just follow the guidelines that we're going to say right now and show you in the treatment, and that would be sufficient for them to have very good results. The way that the treatments go is that they have treatment at day 0. In 30 days, they can actually repeat the treatment, and then they can live anything between 1 and 2 months. So at 60 or 90 days, they repeat the treatment. Then they can have a treatment after 6 months or after a year, depending on the patient. When it comes to the body, things are a little bit different. So you can continue every 30 days to be doing the treatment for as long as they need, because it depends on how much fat you have in the area and how much laxity you have. We're talking about a lot more work to be done in the proposed area. Another thing before we start is that you should put the total counter on and ready, so that you know how many pulses you do every single time you do your patient. What I advise the people operating the machines in my clinic is once they finish, they take a picture of what they've done, so they know exactly how many pulses they have done, what kind of energy they've used, pulse duration, the frequency, everything, and they write it down. Then even if they move on to do another handpiece, then they take another photo and then they can insert it into the patient's notes, so that they know what they're going to use the following time. So we have prepared our patient. We have prepared the setting of the machine. As we said, we're gonna start with the 4.5 millimeters. So if you see also on the handpiece is the 4.5. We chosen 50 milliseconds, 4 hertz, and 1 joules. We press ready. So once you have chosen ready, you can see that the membrane that we have there has actually been filled with water. So it forms like this concave shape to the surface. We see in the middle that there's that hole. As we said, that's our centerless. So the ultrasound actually comes out right in the center of the handpiece. So the handpiece is ready. What we should do is clean the face of our patient. So we cleanse the face. Just make sure that there are no impurities, there's no makeup, there are no crimps. So before we start, we just mark out the areas that we shouldn't be treating. So this is the area around the ear, close to the mouth. and afterwards for the neck is the thyroid. So what we can do is you can take any ruler and you can put it from the one side to the other, and then you just draw every ½ centimeter. You make a line so that you know that these are going to be your lines when you're treating the face. Then you move vertically, and you do exactly the same thing vertically. So every ½ centimeter you move all the way up. Then you know that once you have drawing, wherever you have a line is where you actually have to move. Once you have labeled the area, you go on to apply the gel. And the treatment is ready to start. So, as we said, we've already set up our machine. We pass the handpiece on the other side so that we are comfortable. We should be pressing here the button once we are on the skin. So we place the handpiece onto the face and we press the button. And we start moving slowly as it goes the beeping. So this is the speed of our hertz. And then we count. So I move now, it's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then you move to the next point. 1, 2. Basically, you just have to measure 10 times. One going, one coming back, or 5 times going, coming back, until you cover the whole face horizontally. So you move slowly, you move very little your handpiece, as we said, like ½ centimeter every single time. Remember that the ultrasound comes out from the middle of the handpiece. So now we're gonna move around the forehead. We can see that we've got a good thickness in this area, so I would use the 3 millimeters to treat the whole forehead and this area of the eye. So let's go to change the depth first. So we keep on moving, pressing on the depth and the next button until we arrive to the 3 millimeters. At the same time, we have to change the depth on our handpiece. So if we see the 3 millimeters are right over there. We always use 50 milliseconds. For the forehead, we can keep the 4 hertz. As I said, we always decrease a little bit, so let's start with a 0.6 joules. We put the total counter and we press ready. So now we have to divide the face into half. So once again, we can place our ruler around and start marking every ½ centimeter or how we should actually move vertically. And then we can do the same thing of how we can move horizontally. We first do the forehead and then we go to the contouring of the eyes. Once we have finished of marking out, we can always apply our gel. We have already set up the machine, so we can go ahead and use it. So first, we place the handpiece. Remember that it's in the middle of the handpiece from where the ultrasound comes out, and we go slowly back and forth. So it's again 10 times, and then we move a little bit so that we take the next point. So you move on like this until you actually have covered the whole forehead. Once you finish doing your horizontal lines, you can start with the vertical. So you go back and forth. And it's again, you can measure up to 5 and come back when it comes to the vertical. So we do 10 horizontal, 5 vertical. Once you finish with the forehead, you can move on to the eyes, and we apply gel onto the whole skin. What I would advise you, however, is that at this stage, make sure that you have removed the gel that you have on top, on the forehead and on the cheek. This is very important because we are going to use our cotton pads to actually pull down on the eyes or pull up on the eyebrows. So I cleanse my area. I make sure that I've cleansed the whole thing. So once we have cleansed the area, what we do, obviously when it comes to the eyes, you can decrease, see what type of skin you have there. If you also have to change your parameters to 1.5 or if 3 millimeters are indicated. And the first thing that we do is that we take a cotton pad, we place it on top of the eyebrow and we pull up. So now if you see, all the skin that was down there is actually found on the bone. Now I change my frequency to 1 because when it comes to the contour of the eye, I have to be very careful. So I have to be able to control my speed. So I have to move slowly. So I pull it all the way up. I place the handpiece. As I said, the middle of the handpiece is where you have the ultrasound. Make sure that the handpiece is touching, and then slowly you go to treat the eye. You can go all the way to the eyebrow and then you go back. When it comes to this area, you don't have to go through it 10 times. It's enough if you go back and forth twice from the same area. So we did once, and then slowly we do the second time. Then you just move it a little bit and you go to do the same treatment. And now we're just treating the upper eyelid skin. Once you have treated this area, and we move on to the whole eyebrow, you can increase a little bit your hertz to 4 again, so that you move to the areas here around the eye that you may have the wrinkles. So here we move back and forth, back and forth. We go like 10 times around this area because we're trying to target those lines that we have around the eyes. And then we move again a little bit our handpiece until we cover the whole area. So you do the whole thing 10 times from each side, then you come under the eyes. You put a little bit more gel, just a little bit, you don't need too much in this area. You hold the skin, I'm just going to turn a little bit. So we turn a little bit, we hold the skin, and we move back and forth to just cover the lines that we have under the eye. If you want, you can also do a little bit of vertical lines just to target those little stubborn wrinkles that we have around the eyes. Don't stay too much, maximum, because it's a crossing over. When you do the vertical lines, do it 5 times and we're done. Then we have to cleanse a little bit the gel that we have placed under the eye, so that it's not going to be slippery when we are going to be moving our handpiece. We place a little bit more gel under the eye. So just take your cotton pad when the skin is dry, pull it all the way down. So look at the skin here, look how it comes all the way down. The bone is right here. So by pulling down the skin, I'm able now to treat the area under the eye. Here, as I said, if we don't have experience, it's the beginning of our treatment, you can put it down to 1 hertz so that you're not going to harm the patient. And you do your 10 lines going back and forth and then moving a little bit to the next line. So once we have finished also the eyes, again we take a picture of our screen so that we know with what parameters we have actually worked. I'm just going to do a quick recap. When it came to the mid phase, we used the 4.5 millimeters. If you want in the same session to use more than 1 depth, you can do so. Don't use all of them, you can use maximum of 2. If you're going to use 2 depths, please first start from the deepest one, because when you go deeper, then you're going to cause some inflammation. If you start from the more superficial one, then if you're using, for instance, the 4.5, you will not be at the 4.5 level. So always use the handpiece, the depth, the deeper one first, and then the more superficial one. Don't use more than 2 depths at once. Try to start working with 4 hertz until you get hold of the machine. mark out your area. It's every half centimeters. When I'm moving horizontally, I count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then I move on to the next level until I do the whole area. When it comes to the vertical, because it's the crossing over, I do 1, 2, 3, 4, 5, and that's enough, and I move on to the next one. So this is in regards to the mid phase. Trying to use anything between 50 and 75 milliseconds. I always advise you start from 50 milliseconds, slowly play with your jowls. Don't arrive at 2 jowls, it's too much. You should look to work anything between 0.8 and 1.6. Then when it comes to the 3 millimeter is more or less the same. Then once you finish, take a photo of your screen so that you can write it into your notes, how many pulses you've done, what parameters you have chosen. Then move on to the forehead. When it comes to the forehead, again, you can mark out the area horizontal and vertical. Once again, move horizontally 10 times and vertically 5. Use the 1.5 or 3 millimeters. Done that, take a picture, move on to the eyes. To the eyes, remember that we always pull up and we work only on the bone, we pull down and we work only on the bone. Once you have done that, you can also move on to the neck area. The neck area, it's very simple. We just mark out the thyroid and then we start working vertically and horizontally in exactly the same way as we did on the face. The only thing, once again, if we have a double chin, there is the only time on the face that we can increase the pulse duration so that we're going to target the fat even more. So let's go to see the neck. So when we are treating the neck, the first thing that we have to note is to separate the thyroid. If you want, you can do it by the eye. So you take from the sternocleidomastoid here and you come all the way up here, or you can actually palpate the thyroid and see until where it arrives, so we can see that it's here and you can actually mark it out. Then you do the same on the other side, so we see his thyroid is up to here more or less, and we mark out this area. Once we have marked out the area, we are going to ask our patient to move his head on the side because we want a flat surface when we're going to be working. Once again, if you're only going to do the neck, do not start from the jawline. Start from here going downwards because the platysma muscle, it starts from here going all the way down to the clavicle. So you start from here even when you're treating the neck. So what we are going to do, once again, we're going to mark out, we have marked out the area that we're not going to work. We can put our ruler and then we can start to mark out every half centimeter so that we can actually move vertically. And we can do the same thing horizontally. Once you get hold of the machine, you won't be needing to be marking out the area, because once you've done this about 100 times, you know more or less where it's the half centimeter. So once we have done that, we place our gel. As I said, if we're starting to do the neck, start from here, so the line of the mouth. If you have already treated the upper face, you don't have to. You start from the jawline and you can actually treat. So here we don't have a lot of fat in the area, it's more of laxity. So setting up the machine, I would again start with a 4.5. So let's go to set up our machine. So setting up our machine, and once again we go to face, we go to the depth and next, and until we find the depth, which is the 4.5. We put it straight away on our machine to the 4.5 noted here on the handpiece. I will always start with the 50 milliseconds. Here on the neck you can move to 4. As I said, with experience you're gonna increase a little bit the frequency. And then when it comes to the energy, start a little bit low, start with a 0.6 joules, and then you can increase based on our patient's comfort. So let's try to see also how this comfort of the patient comes into the picture. So I'll put my total counter ready. I see that my handpiece here has been filled with water, so I'm ready to start. Let's have a feedback with our patient as well to see how we can actually use the machine and if we can increase the energy on him. So I place the handpiece and now I start. So can I increase? Yes?
Yeah, increase a bit.
So I move to 0.8. How do you feel?
I feel it.
Do you feel the heat?
A sort of needling.
So he feels the needling, so that's good. It is normal that, especially when we are on the jawline at the mandible, that they feel it a little bit more than they do when we're going to be moving downwards on the neck. So wherever you have bone or in the middle of the face, they should be feeling it more. It's normal. If you want, in those areas, you can actually decrease it a little bit, and then you can increase again when you have moved on to the area where it's not so bony or there's not so many nerves over there. And then if you have experience, you can actually move it all the way to 10 hertz that we do this kind of treatment. So when we're treating the chin, under the chin, the double chin, we ask them to lift the chin up. Però vedi qua che perdo un po' di contatto. Il metodo di fare il I double check, that's it.